All of Australia and much of the world is going through some challenges at the moment in response to COVID-19. Part of that is the experience of social distancing or social isolation, and it's creating different dynamics within households and even workplaces where colleagues have to rethink what it is to be in the same space. Brett Williams, principal at Adelaide Night and Day Family Therapy, in his work as a family therapist, is right at the coalface with this, and I thought I'd have a chat with him about the way he's viewing this time in our history. Hello, Brett.
Yeah, hello, Steve. Good to see you.
Indeed, and we're seeing each other in what is now the norm.
It is becoming so, certainly for us.
Yes. So you are embracing more of the availability of having therapy sessions in an online chat situation. But before we get there, just what is happening as far as your response at your practice in relation to COVID-19 and things you need to do from a safety perspective?
Well, COVID-19, obviously, we're trying to do social distancing or keeping people separate from each other as per the federal government's guidelines. There's also the idea of basically keeping people safe, which is part of keeping people safe from the virus, but part of that is also our infection control guidelines, which we always have had down here. We have stepped them up a level. We do wipe absolutely everything, including the actual seats of the couches in between every session. We used to do just the arms of the couches and our tables and so forth between each session. Of course, we clean our all our crockery and glasses and so forth. But we've always had those in place to keep our people safe from if they're vulnerable, because we do have some vulnerable clients here at Adelaide Night and Day. We have a number of people living with disability, and so we've always been very careful. But here, under the COVID-19 issues, we actually have to step that up. So we wipe absolutely everything down with soap and water after every basic client.
I also can see that the room you're in is quite a large room. I suppose you're making good use of that space.
Yeah, this is actually one of our smallest ones, but yes, we make sure that people keep to the 4 square meter rule
Okay.
in all our sessions. Also, we try and do the same exactly with our reception and try and keep people from flowing all in at the same time. So we try to step people away because I can see people and have for such a long time seen people via video conferencing or teleconferencing or telehealth. It was the easiest one to first take that up, and I've tried to do that to stop the congestion in the practice.
On that note of social distancing and the social aspect of this, tell me, many of us have this ideal that, oh, we have to go to work for the week and we're looking forward to getting home, that ideal with family. But we know from experiences around
Mm.
Christmas that family altogether does bring some challenges. What are you seeing as far as husbands, wives, families now being confined together, some of whom are working together, let alone just trying to do their own jobs? Talk us through that from your perspective.
Yeah. Well, I'd be really interested in hearing from your perspective about what Christmas does. So, but that's a whole another story. But once people are thrown together, working from home, working in the same place, having very few places they can go out to, uh, even at the moment, while people are actually feeling like they need to stay at home, they're not going out for those walks even outside for fear of contamination, for fear of catching the virus, for fear of becoming vulnerable. Yet and that may actually be increased depending on what goes on. The government's not telling us whether they'll do that. They're certainly not liking the use of the word lockdown.
This is a time where the stakes are higher than normal, you might even say,
Mm,
of dealing with strategies to coexist in
mm,
small spaces with
yeah.
family.
And with kids home from school, not seeing their friends, you might have people who have just lost their job. I mean, I've seen quite a number of families this week where one or more people in a, say, a 4-person family or larger or smaller than that are all in the same space with grief from having lost jobs, having not seeing their friends, not being able to go and do the social things they're used to doing, their sport, so they're missing out on quite a number of activities they would normally do. Going to the gym, which has become such an important part of so many people's lives. So they're actually sitting in a place already with grief. When people are actually grieving, people are hurting, there's anger, there's denial, there's isolation, depending on which stage of grief they're in. And so all those little things and people's coping mechanisms come to the fore. For instance, your coping mechanism might be to argue with something or fight something. It might be flight, so you might normally run away. It might be freeze or feign death. You do that in a small space and over and over and over again, if that's your normal coping mechanism, and you're doing it with other people who have different or the same, of course, tensions escalate or your coping mechanisms no longer work. Because where can you run to if there's nowhere to run? If two people use fighting as their normal coping mechanism, of course, escalation will happen.
There's a range of different therapy modes that you offer. Which of those are available using what they call telehealth? So what's similar to what we're doing now, having a video session with someone?
Yeah. Well, we have family therapists, counsellors, and we have occupational therapists. So at the moment, if people are paying full tote odds, which they do for counsellors and family therapists, where there's no rebates or generally no rebates at the moment, at least for myself, there's certainly none. So they can use it right now, which is why I've been doing it for a long time, because most rebates didn't cover that. But now the NDIS has stepped up and said that consults can be done where appropriate by telehealth. Our occupational therapist and our counsellor who's NDIS registered is actually able to do that and do people by telehealth. And that's at the discretion of both the client and the therapist to do so. It allows them, of course, to keep themselves safe wherever they are, and also to cut down on the pressures. With the occupational therapists, the mental health occupational therapists who take Medicare referrals, that's rather difficult at the moment because it's only restricted to very specific cases.
So it's a fast-moving situation as far as some of that aspect is concerned, but the short answer is your website, which is adelaidetherapy.com, has a solid page that you're keeping updated on that. Plus, people can always call and email, can't they, just to find out what's going to work for them, because at the moment we've got a few months at least ahead of living like this, and I imagine the sooner that you acknowledge something and reach out for support if you think you need it, it's going to be better.
Absolutely. And certainly calling us is the best way of getting information, because then we can have a dialogue. And then maybe even our admin staff may be able to actually use the same tools in the near future as well, so that we can video conference in and have a chat, so that you can get to know what the place is like and whether the place is for you. And that's what their role is at the moment in terms of on the phone. Of course, with telehealth, it can be done on the phone as well without video. Video is far superior because you can see the body language. The body talks and tells us the way people look when their families look when they're relating to each other. There's a lot of non-verbal information there about what's going on for the individual, what's going on for the couple, how they relate to each other, how a family might relate, what's going on with a child, that you can see when you can see facial expressions, body movement, and there's some. And also one of the great things about teleconferencing and video, as distinct from telephone, is that usually families pick up the computer or pick up their phone and show me around their environment. So it helps me understand the context of some of the problems they're having, some of the things that might be able to do, some of the shifts we might be able to make things easier for them, especially when working from home, living in home, recreation in home, and even sleeping, which can be another issue for people.